I'm Ron Petersen, the director of the Mayo Clinic Alzheimer's Disease Research Center, and I'd like to discuss a paper that was just published in the Archives of Neurology entitled Mild Cognitive Impairment 10 Years Later. By mild cognitive impairment, we refer to sort of that intermediate stage between the cognitive changes and memory changes of normal aging and what might be the very earliest features of Alzheimer's disease. These individuals are memory impaired beyond what they ought to be for their age, but otherwise they're functioning quite well. Their activities of daily living are intact, and they really look normal to the casual observer. However, over the past decade, by studying people who have mild cognitive impairment, we've come to realize that this may be the very earliest clinical features of what is Alzheimer's disease, and consequently, it has really attracted a great deal of interest. In the past 10 years, there have been numerous studies published, thousands of studies on mild cognitive impairment. Some of these have involved following large cohorts of patients and individuals with mild cognitive impairment for several years, and most of these studies have demonstrated that people who do have the features of mild cognitive impairment have an increased risk of developing Alzheimer's disease in the next 2 to 3 to 5 years. This has also led to a variety of treatment trials. So there have been randomized clinical trials of various drugs, those that are available for Alzheimer's disease as well as several other drugs that have really tested the hypothesis of can we slow down the progression from mild cognitive impairment to Alzheimer's disease. Unfortunately, to date, almost all of these studies have been negative, but it still remains a very active area of investigation for early intervention into the Alzheimer's disease process. Approximately 10 years ago, investigators from the Mayo Clinic published one of the initial papers on mild cognitive impairment. This paper served to set the scene, define the characteristics of the entity, and also provided some longitudinal data. Over the years, other investigators around the world have in fact developed their own cohorts of individuals with mild cognitive impairment and have followed them over the years. Again, most of these individuals have progressed on to Alzheimer's disease, and there have been many studies done predicting which individual subjects will progress more rapidly than others, and that's an active area of investigation. Many pharmaceutical companies and universities around the world are now designing therapeutics to intervene at the earliest possible stage in the Alzheimer's disease process. Mild cognitive impairment has been identified at that clinical stage where people are just symptomatic, but they have a great deal left to preserve. Consequently, if you're able to intervene with a disease-modifying therapy, we may very well be able to postpone the onset of Alzheimer's disease or even slow down the rate of progression. So this is a very optimistic view with regard to potential treatments for the Alzheimer's disease process. Currently, there is a major investigation underway sponsored by the National Institute on Aging and a consortium of pharmaceutical companies that is designed to evaluate the role of various imaging measures and chemical biomarkers in predicting who's going to develop Alzheimer's disease. This study, known as the Alzheimer's Disease Neuroimaging Initiative, has really focused on subjects with mild cognitive impairment. Again, these individuals are minimally symptomatic but are at increased risk for developing Alzheimer's disease in the future. So the ADNI, as it is called, has used this group of subjects as the major focal point to assess the value of various imaging modalities and chemical biomarkers in predicting who's going to develop Alzheimer's disease.